Great. Well, welcome everyone to this Health and Harmony webinar on our response during the COVID-19 pandemic. I'm Jonathan Jennings, the Executive Director of Health and Harmony, and we're also grateful that each of you are taking an hour out of your time to join us. We especially want to thank any youth, young people, and teens that may be online with us, and a sincere thanks to any healthcare workers around the world who might be joining us, to you nurses, nurse practitioners, doctors, midwives, lab techs. We really appreciate so much the risks that you're taking for us and for our communities and your communities, and the work you're doing on the front lines of this coronavirus response. So I raise my tea glass to you. Here's to you. Today, as we keep our physical distance, we want to build our social connections with you, the members of our Health and Harmony community. You are partners in this work, and it's really thanks to you, and it's entirely thanks to you and your support that Health and Harmony's work before, during, and after this pandemic was, is, and will continue to be possible. Today, we want to share with you a little bit about our planetary health work and talk about the way that we've pivoted in the last month into an emergency medical response in Indonesia and Madagascar, because saving lives now is going to save rainforests tomorrow. And we know this to be the case because lack of healthcare access is a root cause of rainforest degradation from Brazil to Madagascar and Indonesia in the places that we work. Now, we very much want to hear from you, and we want to take your questions and your comments online. Unfortunately, we won't be able to see you, maybe next time. And you can chat us your questions with the chat function, or there is a Q&A function. Trina, I believe we would prefer people to use the Q&A function, and especially the young people, the youth that are with us online. We really want to prioritize answering your questions. So if you are a young person, a teen, or whatever age, and you do have a question, please let us know, maybe by just typing in all capital letters the word youth or something like that when you submit your question to us on the Q&A tab. Now, Trina Noonan, our managing director, is going to be managing the Q&A and the chat line. Thanks, Trina. Perhaps human interconnectedness to nature has never been more apparent than during this pandemic. Just as with the Ebola virus outbreak and other infectious disease outbreaks like it, nature's collapse has facilitated COVID-19's infection of humans. And we know that happens when activities such as deforestation and building roads, mining and urbanization create the conditions for epidemics of viruses like Ebola and COVID. As we destroy forests and displace biodiversity, we put ourselves in closer proximity to animals like fruit bats or mosquitoes, which can more easily transfer zoonotic diseases such as malaria, Zika, or Ebola to us. And human health isn't determined inside of a vacuum. It's not determined exclusive of the health of the environment around us. Much to the contrary, our health depends on the integrity of the ecosystems in which we live. Access to clean drinking water and clean air and non-toxic soils and foods are essential to the development of our brains and our prosperity. And our economic viability depends on our health as well. If we're sick and can't work, then we struggle to provide for the basic needs and the well-being of our families. This is especially true in lower and middle income countries worldwide, where the effects of COVID-19 may force poor and vulnerable people to degrade their local ecosystems just to survive. Health and Harmony, as many of you know, and some of you won't know, and I don't want to take for granted that everybody on the call today knows us intimately, we are a 14-year-old planetary health organization. Our mission is to reverse deforestation of tropical rainforests in order to reduce atmospheric carbon dioxide and curb the climate crisis. To do that, we are guided by rainforest communities, and we break down the silos between human health, human economy, and rainforest conservation. We focus on tropical rainforests because the simplest, most effective, and least expensive ways of reducing global heating in the next decade is to protect and expand Earth's forests. Now, We're going to be talking about something today, and I've already mentioned the fact that we're a planetary health organization. Well, what is planetary health? It's defined by the Lancet as the health of human civilization and the health of the natural ecosystems on which our human health depends. So unlike the current public health paradigm, planetary health explicitly incorporates environmental and social determinants of our health. And this is absolutely critical. And I want to use the words of Courtney Howard, who is an ER doc in Canada, and she is also a Health and Harmony board member. She says in her most recent op-ed, which she published 2 days ago up in Canada in the National Observer, we can share that with you today in a follow-up email. She says, quote, knowing that only about 20% of our overall health status is determined by actual health care, this means we must push for measures that make life outside of the hospital more stable, sustainable, and equitable. And in pushing for these measures, I would argue that we in the wealthiest countries of the world have an immense responsibility to change our behaviors immediately and more extensively in order to protect people inhabiting low and middle income countries. Now, we want to hear from our colleagues today, our founder, Dr. Kinari Webb, and our program director, Ashley Emerson, both of whom have extensive experience in Africa and Asia, supporting systems strengthening, health system strengthening, and both of whom are pioneers in planetary health interventions. Now, before we jump into questions that I have for them, I just want to remind you, please submit on the Q&A tab your questions and comments to us. Trina Noonan, our managing director, is going to collate them for us, and she's going to periodically jump in and represent your questions and comments. Okay, and with that, Ashley, I would like to ask you first to tell us how things are going in Madagascar with Health and Harmony's operations in Madagascar. I know things there are changing by the minute. How are our teams responding?
Yeah, thanks, Jonathan, and thanks all for joining us this evening. We appreciate your support. We're thinking of you as we're all in this together. In Madagascar, we had just started launching our programs, our conservation, our medical outreach programs. So when the crisis hit in Southeast Asia and other parts of the world, very quickly we pivoted into emergency healthcare response. So what's happening there is they've had the somewhat fortunate experience of being just a few days ahead of us. And they've had very strong national change in terms of being able to quickly close down the country, transportation, large gatherings, some of the most important things to be able to suppress the pandemic in Madagascar. So right now, as of this morning, there are 23 cases of COVID-19 in Madagascar. They're all centralized in Antananarivo, which is the capital. And the strong national response that they're following is really that advised by the WHO. And they have basically 6 points of advice that they give to leaders to be able to set up the best response that they can in terms of preparedness and then action to be able to take care of communities. But as our program manager, Hasina in Tana, said to us, I'm physically distancing in my home with my family, but as I look outside the window in Tana, it's like any other day. And that's because, as you know, in a low-income country, Malagasy people live day to day, and so they don't have the luxury or the resources to be able to stay home. So it makes, the pending pressure on a country like Madagascar very severe. So let me jump specifically to where we work in Madagascar. We're down in the southeast region in an area called Farafangana. It's home to a really remarkable rainforest. And what's so special about this rainforest is it's highly biodiverse. It has one of the last remaining tracts of literal rainforest in the country, which is this beautiful ocean forest. But it's also home to 9 endangered species of lemurs, which are endemic to Madagascar. and so many other, phenomenal charismatic megafauna and plants. And the communities around the rainforest are very, very much interested in supporting its conservation. And the great request that they made from us was to support them in healthcare. So as the crisis arose throughout the world, we were able to really quickly pivot and support our team there to do that. So around Menumbu Special Reserve, the rainforest that we're looking to protect and reforest, there are 30 communities that we work with. And our team there has been called by the national healthcare system to be able to support the local health outreach. So Dr. Evelyn, who has many years of running national coordinated public health outreach endeavors, has been able to quickly respond to be able to step up and support local outreach throughout Farafangana with specific focus on Menumbu, of course. And so she's not only helping train some of the frontline professionals, but she's helping to set up some of the resources that are needed at checkpoints that have been set up to reduce the spread of the virus from Antananarivo down into Farafangana. And she's also supporting what we call the CSBs, and those are the local healthcare posts around the region to be able to equip the staff with materials and medications, and most important at this point, really education on basic sanitation, physical distancing, things like that. So in this effort, we're really taking a health system strengthening approach. We're shifting our funding and our support toward the approach that the government's taking to help capacitate the local staff, the local actors, and the CSBs to be able to make as big of a difference as they can right now. So in terms of the needs that are coming to the surface, there are many. In a place like this, they experience the same things as us right now: severe shortages in equipment and materials and supplies. That's compounded by issues like poverty and lack of access to basic needs such as potable water and food. So right now we have over $30,000 in emergency response requests, and this is just really for the preparation and prevention phase. We don't quite have the full scope of what the impact of this virus will look like in the Farafangana region when it does hit there. So right now we're doing everything we can to be able to quell the infection rate.
Okay, thank you, Ashley. And now, Kinari, you've just returned from our programs in Borneo in Indonesia. Can you tell us about the situation there, and what was your experience, and what were you seeking to accomplish during your weeks there?
Yeah, so I just got back, and man, was it an intense period of time. I expected to be there much longer, but I had to actually cut it short. But what was really interesting is that I discovered is that we are unexpectedly extremely well placed to help in this pandemic. Not only do we have a well-reputed medical facility that has the capacity to help care for many, many patients, and it may turn out that we need to take care of many, many, many thousands of patients. God willing, that will not happen. But also over the years, we've developed this really very, very positive relationship with the local government. And that meant that they really listened to us. And I hit the ground running, and we immediately went and had meetings with the local Department of Health, with local government officials, and even before we had the first cases in Indonesia, and they actually listened to us. And we had a big coordination meeting, and we strongly encouraged them to mobilize emergency funds, start buying protective gear. And thank goodness that actually happened early enough that they were actually able to get a lot of stuff. And now they're doing stuff like they actually shut off the one road into our regency and are screening everyone's temperature, and actually they're sterilizing the cars. I'm not sure how useful that is, but and then every boat that comes in as well, they're screening everyone's temperature. So we are kind of relatively isolated area, and so that's kind of exciting that they are taking it so seriously and that they are able to kind of bring it together. And then the really big unexpected thing is that we are having the capacity to work at a national level. Over the last 15 years, our partner organization in Borneo called ASRI, that I also helped co-found, has developed a really positive reputation. We've won a lot of national awards. We have a lot of friends in high up government positions. And ASRI's previous executive director, Monica Nirmala, she was just at Harvard, and she did a public health degree. She was the only Indonesian there. And then within days of returning, she was just thrust into the middle of this pandemic, and she's found herself to be a really essential player in the response. So she's already been on multiple times on national TV, she got invited to be a key advisor to the head of the COVID-19 response for Indonesia. I feel really bad for these guys because they are in a truly horrible position where they have to balance economic collapse and millions of deaths, and they're kind of frozen. They don't know what to do. Monica is really pushing for a South Korea style response with just massive testing and mandatory isolation. She and I are coordinating every single day about this and working on the strategy for influencing them. It's constantly shifting. I would say, though, it does seem like she's starting to make progress. She's also teamed up with two people from the CDC, from the U.S. Centers for Disease Control, that I actually had met when we'd had big events at the U.S. Ambassador's residence. And as soon as they heard that Monica works with ASRI, they were just like all in, and they were like, okay, let's work together. So the three of them are going around to all these government meetings. So it's really interesting because that's what all these years of trust building has created. And now we're working on a level that wouldn't have seemed possible even just a few months ago. But with extreme events like this, there's also this opportunity to shift the paradigm. And as we all know, our world really needs shifting to a planetary health approach. And I'm so grateful that Monica is there in the center in Indonesia. Our team is on the ground. We have already demonstrated models for how to do this. And in Madagascar, we're also being able to help really shift the conversation and influence the thinking about how the health systems, if they need to be rebuilt, how they might be able to be rebuilt in a way that is much more focused on planetary health. So I also just for a second want to talk about our urgent needs. I'm really worried about our team. We desperately need protective gear for them. We have some, but it's not enough. We need all kinds of supplies. Keeping our nurses and our doctors safe is essential for protecting lives, for protecting rainforest, and for protecting livelihoods now and well into the future. And then we also need money for Monica. We've hired her to do this work. She didn't have the consulting job she was going to take, fell through because of all this. And she just needs to totally focus on this, and we want her to be doing it, and it's so important. But she also needs money for constant taxis as she's racing about Jakarta. And she also needs an apartment so she doesn't put her parents at risk as she's talking to all these people. So that's just a little bit of what's going on, which is, it's intense. It's really intense. And I also feel incredibly grateful that we have the capacity to really make a huge difference in both Madagascar and in Indonesia.
Yeah, and I applaud you both, and really the whole Health and Harmony team for pivoting from this sort of standard planetary health, more development sort of pace to a truly medical emergency pace. So thanks to you both. And if you're just joining us, we're 20 minutes into the webinar, and we really want your questions and comments, and you can do that by touching the Q&A button on your screen and then submitting a question. And if you are a youth or a young person, we really want to prioritize your questions, and we would like for you to type the word youth in all caps so that we can prioritize your questions. And speaking of that, Trina, anything, any questions coming in that you would like to relay to us?
Yeah, we've got a couple follow-up questions, Kinari, for you about what's going on in Sukadana. And first, Nancy's just wondering if there are currently any COVID-19 cases in Sukadana yet, and what's the status of the Regency?
So the answer to that question is we don't know. And the reason that we don't know is because we don't have any testing capacity. However, there are 20 people who are currently in quarantine. So, but some of those are just like they came in from Jakarta, and we, and like a staff member of ours as well who came in, and we're just putting them in isolation just to be very, very safe. But that is more than the other surrounding areas have. So that's a little, but that may just be because also our Regency is on it, and that may be partly because we gave a warning. Yeah. And the other question, Trina?
Yeah, so the other question's from Heather, who's a first-year medical student. She had been planning to visit Osri this summer, but now that's a little bit up in the air, obviously, as we've sent all of our visitors home. So her question is if we foresee allowing visitors to return in our upcoming months, or if the pandemic is just too unpredictable at this point to say. And Ashley, you may want to weigh in on this too, I'm sure.
I just have to say it's too unpredictable to say. If we develop a treatment that really makes an enormous difference, that could change the whole equation. But it's concerning, and I think you better not plan on it. But we would love to have you come, but we're definitely trying to limit exposure for the folks there. Yeah.
Heather, send us an email, and maybe we can have Skype contacts to support your interest in planetary health.
Yeah, and
online.
We are putting that program online and bringing it virtual. It was due to our duty of care protocol for that program, and our duty of care means lots of things for our organization, but as it pertains to travelers and doctors and professionals that go to Osri to learn from the planetary health leaders there, it's about, what do we do if something goes wrong? And so we were able to see what was happening with the virus in China, and that triggered our action to respond and quickly close the program down, get people out, and start to think differently about how do we minimize, most importantly, exposure, to the communities in which we work and the most vulnerable, but also folks traveling in that program. So unfortunately, we take a zero risk approach to the travel program, but we will bring it online, and we'll have more information about that soon.
Thanks. Trina, do you have more for us?
Yes, I do. And I'm typing some answers in too as well, so that we can try to make sure that everybody gets their answers today. One more kind of specific question, and then we've got some bigger picture kind of planetary health and global impacts questions too. But first, just on Osri, and I think I'll personally expand this to Madagascar too, but do we need funds to purchase tests, or are they not available yet in Madagascar and Indonesia?
So the answer is I'm trying desperately to get them. I have requests in to buy from 2 places. Monica's also working on the national level to make sure that they can be imported legally, and that looks like it's happening. I haven't gotten responses we're trying to buy the antibody test from China, which they already have in Indonesia. They have 500,000 of those already. They're only $5 a piece. If we could get, $100,000 worth of them, that would be amazing. But yes. So yes, we need the money in the anticipation that we can actually buy them, but I don't know if we're actually going to be able to buy them.
Yeah, and similar in Madagascar, they just received a 100,000 test donation from China, along with masks and some other equipment. We know they'll go through those quite quickly. So none of those tests have, of course, made it outside of the capital.
Right. Yeah.
Great. I think we should shift into some bigger picture questions. We've got a great question from Gary about what should organizations that are already working in the field at the forest and community interface do to scale up appropriately to address our current and future environmental challenges?
Jonathan,
Great question. Great attitude. I'll start by saying ensure your staff's protection. Ensure that you know what's happening with COVID cases in your project area. If they get sick, as you don't need to be told, then nothing is possible. But it allows for a great segue into the promotion of the health of humans and the ecosystem integrity, which is what we're going to talk about in just a few minutes. Before I go down that road, Ashley or Kinari, do you have anything you would like to say to Gary?
Yeah, I mean, I think in terms of scaling up and impact, we know that if we support people's health, that will have a massive impact on conservation and livelihoods and so many other things. But there's a reciprocal and bidirectional relationship when you do it from a planetary health lens. So you're supporting the health of the environment and the health of humans. And so, this is the future we're thinking towards that we'll talk a little bit more about later. But yeah, for us, we're in the same mode as Jonathan just said. We're very much focused on frontline staff, supporting frontline staff in any way that we can do that. And sometimes it's the most basic forms, such as, giving your staff an additional month's salary to be able to buy extra materials when there's surge pricing in places like Madagascar and Indonesia, and people do need to do a bit of stocking up so they can physically distance. So it can be very basic and also very complex.
I would say you can further bolster the relevance of your intervention if your ethos is making the link between human health and prosperity and ecosystem integrity, just by simply educating that COVID-19 and other infectious disease outbreaks have been a direct or indirect result of environmental degradation. Okay, so where we protect the environment, where we protect our ecosystems, we have significant knock-on advantages to our own household economies and our own household health. Good. Ashley, I wanted to ask you, we often note how healthcare systems, especially in the West, are focused on sick care and not healthcare. And I was wondering if you could elaborate on that.
Yeah, and I'm certainly not an expert, but what we think about in this field is healthcare is a major intervention, as we see, for conservation. And right now, what we're struggling with in so many countries, especially this one, is we have a healthcare system that's very much built on addressing chronic health issues. But that healthcare system had been founded initially on infectious disease. So we're almost having to go back and relearn how to respond to these really challenging epidemics and pandemics that we're seeing over and over again. And so I think we try and challenge that through our work with OSRI and through our work in Madagascar and our hopeful planned work later this year, early next year in Brazil, where we see and recognize the interconnectedness of human health and environmental health and the pillars of sustainability that are born from that interconnectedness. So, what we try to do as we make quick decisions is keep that frame in mind. And at the heart of it, as we keep saying over and over, supporting the health and well-being of individuals in this crisis will have the byproduct of continuing to conserve and support the environment, which otherwise communities in need and in poverty in these situations turn to, have to degrade and extract from and cut down to be able to get quick liquidity to survive. But I think it's our job to support the most vulnerable in the global north, particularly those in the global south, as also as the biggest emitters of carbon. And so we have a responsibility, I think, in this pandemic that we're trying to keep very much a planetary health lens, while also recognize at the heart of it, we're taking a public health response.
Good. Trina, any other questions?
Oh yeah, we've got questions coming in, which is great. Thank you, everybody. So we have a couple people asking about planetary health and what our perspectives are on what planetary health is, and also what is the relationship between viruses like COVID-19 and rainforest ecosystems. So maybe Jonathan, do you want to talk about this kind of planetary health perspective? What planetary
Sure.
health is and the perspective on coronavirus?
Sure. And for everybody to know for everybody who might be new to this new discipline of planetary health, which is now about 5 years old, we will share a link to you where you can educate yourself, through some of the seminal papers. As I said, it's defined as the health of human civilization and of the natural ecosystems on which our health depends. And when I first started at Health and Harmony about 3 years ago, I used to joke with Kinari and razz her a little bit about why didn't she come up with this term planetary health in this definition? Because since 2005, 6, and 7, Kinari and our Indonesian partner Osri has been doing exactly that. And the way that it's done, the way that we do it is, as I said, we're guided by local and indigenous communities. They're the experts. They know the drivers of local deforestation in tropical rainforests, and therefore they know how to reverse that deforestation. And we use a methodology that we call radical listening, which is something that Kinari and her Indonesian colleagues more or less invented, 10, 15 years ago, and we've worked significantly to improve. We enter these rainforest communities and we facilitate their locally designed solutions, and then we invest precisely in those solutions. And humans don't experience our challenges in silos. Okay, so when you ask these communities, how might we assist you, or what might you require to stop illegal logging or deforestation, it's never just about health or just about agriculture or just about economics or just about education. It's a system, right? And so we're unique in our commitment to invest precisely in their systems design. And that's a very planetary health attitude, ethos, principle, and practice, right? And I would invite you to check out the 12 core planetary health principles. We can share those with you. But that's, I would say, one level or one aspect of the answer that I would like to give. The second is, and this is more recent thinking, the systems approach that we take. And I would invite you to go to our website, healthandharmony.org, look at the profile film, look at some of the cross-sectoral impacts of the way that we work, including 90% reduction in illegal logging, household economies improved, massive rainforest protected, and massive carbon kept in the forest and not released into the atmosphere. But what we're thinking more about now is we have 10 years to fundamentally change society, specifically to reduce the carbon dioxide that we pump into the atmosphere by 50% by the year 2030, and then be carbon neutral by year 2050. Well, that's going to require, at the level of cities and at the level of governments, massive systems thinking or massive reformation towards systems thinking. So if you think about governments around the world and the ministries, the ministry of this, the ministry of this, the ministry of that, or even in our own government, it's still very siloed, right? Health and the healthcare system is still siloed and exclusive from finance and economic system, which is siloed and exclusive of the conservation and the protection of nature, right? Well, we want, during this pandemic, the planetary health ethos and mindset to seed itself, and it is, but in such a way that it catalyzes real reformation, real understanding of systems-based approaches and systems-based governance. I'm going to stop there and allow anybody else to chime in.
Yeah, I just want to say amen, Jonathan. It's just, and there Monica is dashing across town because they can't even talk to each other, and it's just like, what? She keeps saying, we need a war room. We need everyone in the same room to think about this all together, right? So I said, well, you're going to have to create the war room. Yeah. Which she's doing.
Yeah. I mean, fundamentally, we can no longer ignore our interdependence and our interconnectedness, right? And then there's a major element of planetary health, which is involving social equity. And I'm not going to go into that just yet. But Trina, what else do you have? from the ether.
So one kind of follow-on question about the relationship between COVID-19 and the rainforest ecosystem is also just a concern for our orangutan friends. And do we know yet if they have immune system responses to COVID-19, if they have immunity to it, or if they'll be similarly impacted?
Yeah, I have actually talked with International Animal Rescue with the main veterinarian, Carmeli, about this issue, and she said they are fully expecting that the orangutans will not have any immunity to it and could be very severely impacted by it. So they are, doing everything they can. That's a rehabilitation center, so they're social distancing even more from the orangutans than they normally do, and being even more careful about protective gear. Yeah, they are very concerned about it.
The same thing for lemur species. There is no protection, and so there's a protocol that's been distributed throughout Madagascar. Because there is such a vibrant tourism economy around lemurs, and it's part of the fabric of Madagascar, that remarkable animal. But there are a lot of protocols around how do you continue to support and work with lemurs while also protecting them from this virus. So again, another really fascinating interconnected planetary health perspective.
Yeah, it goes both ways.
Mm-hmm.
Yeah.
Thanks both. Trina, any questions from youth or young people?
I haven't seen any flagged as that yet. Yeah, definitely if you are a young person who's joining us. Oh, here we go. From Isaac.
On cue.
Yeah, Isaac is wondering, do you think that this outbreak will lead to fundamental changes in how governments view and act on conservation? Great question.
Isaac, if you want it to, it will. If your generation, and I don't know how old you are, but I know you're younger than me, if you and your friends step up and make this social change happen, then it will. And I'll hand over to you now, Kinari.
And just also to say that China is closing its wet markets. These are it's a horrible term, wet markets. It means live wild animals they're selling to be eaten. And that's also where SARS came from. It's where MERS came from. It's a disaster waiting to happen. And it's been predicted for a long time that the more we destroy these ecosystems and we take these animals out of them, there are lots of viruses that are perfectly happy and no problem and are not a problem in their own ecosystem. But when they, transfer to humans, they can be very problematic. Ebola, something that it also comes from the forest, right? So these are, it is very important that we use this opportunity to talk about how one must not be eating wild animals. We just can't do that. There aren't enough of them left. We have to protect them, and we need to protect our own health. So,
yeah. And I think something that it's really raising people's awareness around sort of the exotic animal trade and how animals are affected. But something that we're also starting to see a lot of researchers and folks talk about is the generation that gets most impacted by something like a pandemic is your generation. And so this becomes a defining moment, a defining moment. I have a 8-month-old baby, and this is a defining moment for his generation. And so our hope at the end of this is we have a generation of not just doctors and nurses and epidemiologists and public health workers and people who are constructing cities, but they all come from a ecological, biological mindset because there's so much more awareness now around this. So it's a great question, and as Jonathan and Kinari said, it's we look to you and we look to support you in that.
And would encourage you to think beyond where the media tends to focus, which is cause and effect and immediate solutions. We need to build systems and reform ourselves so that we don't have more Ebola, we don't have more COVID, SARS, et cetera. And it's the destruction of nature and often the climate crisis that are the root causes of these problems. Good, Trina.
Yeah, we've got some more questions on the specific health status in Indonesia and Madagascar, but before we move off the topic of education, both Darren and Steve are asking about kind of what the current status is of what people know on the ground in Indonesia. For example, is the news coverage in Indonesia telling the right stories, the accurate stories about the origins? Do people in Sukadana know about the origin? And then Steve's wondering, what are we doing about education in the community on social distancing and safety as well?
Yeah, so we are doing a massive education campaign. And one of the ways that we're doing it is that we have a huge database of all of our patients. We've got 90,000 patient visits, like 40,000 individual phone numbers that we have. And so we're just texting everyone, right? We're telling them all, and we're designing all kinds of messaging to send out. So that's been helpful. We also, this is like Jonathan connected us to the Doctors Without Borders folks in Indonesia. They have a whole bunch of material that they had produced for community education. We then gave that to the government, as well as printed a whole bunch of it up ourselves, and that has also been being distributed. So as for the government, there's definitely, like in the US, want to blame the Chinese government, which is very sad. And there has been a accusation that it's bioterrorism, which is ridiculous. Monica has been very clear on national TV multiple times talking about the origin. And, we're doing the best we can. Yeah. But, it's going to be a process of, people, when they're afraid, they can become xenophobic, right? Which is particularly terrible in this context, right? Because in this context, we are probably only going to make it if we all work together, right? And if we were truly coordinating around the world, we would be doing so much better, right? If we were sending doctors from one place that's got lower, incidents at the moment to places with higher incidents, and then back the other way when we call, that's how we should all be coordinating around the world. And certainly knowledge is going very quickly. But we just really, really need to understand our interconnectedness. That should be the main lesson that we're learning from this. And the more we work together, the better we can solve problems, including the problem of climate change. Yeah.
Good. Trina, I'll just leave it with you.
Yeah, absolutely. So Brian is wondering about health issues that people in Madagascar and Indonesia are already dealing with and how those might impact their resilience to COVID-19. And Melvin is also wondering similarly about mental health and anxiety and how that might be impacting people at this time, especially economic consequences. Anxiety about economic consequences. Yeah.
Yeah, Ashley, do you want to go first? Yeah.
Can you hear me okay? My connection's a little off. Okay. It's a great question, Brian. Hi, Brian. Good to hear from you. I'm glad you're here. It's a great question. People in Madagascar suffer from chronic malnutrition, diarrheal disease, tuberculosis. There was a plague outbreak in 2017. So there's lots and lots of challenges that are being faced by a very weak, underfunded, and complicated healthcare system. So there's a lot working against countries like Madagascar in terms of how to face this. Part of our outreach response is actually supplying multivitamins and medications that can help boost immunity at this prevention stage to the local CSBs that we were talking about. Because we know, right now there is no treatment, and that's the best treatment that we can offer in terms of nutrition, food, nutrients, things like that, and all of which are lacking. So it's a really good question, and it's part of our long-term plan in Manumbu as well, is thinking about how do we increase micronutrients and diversity in diet? And this is a region that's constantly being pummeled by cyclones, growing very low yield, low nutrient rice. And so how do we think about these ways to mitigate crises like this in the future, in the long term, through our conservation and agroforestry efforts as well?
Yeah.
There was a second question in there, but I'll punt that over to Kinari and Jonathan.
Yeah, concern about mental health, especially as people are more isolated and as people may have great concerns and anxiety about coming economic changes.
So I'm also most concerned about the mental health of our healthcare providers. So OSTRI has over the years trained hundreds of healthcare providers, and they're now all across the country. And I've been hearing from a lot of them, and they're terrified, right? And for good reason. Indonesia's already lost 9 of their healthcare providers and their top epidemiologists, 9 of their physicians, at least 1 nurse that I've heard of. So it's, and those folks are very, very, very hard to replace. That's an enormous loss to the country. And we're just trying to help everyone get the information they need to protect themselves. And just, honoring them for the heroes that they are at this time. Yeah.
I think something that we don't hold back in at our organization is our compassion and our support. And so, any of our orientation, whether it's with new staff or national staff in new countries that we work, our first orientation is around our support emotionally and our compassion and our love for one another.
Yep.
That has to be translated in the work and in the care that they're providing to the communities who may have experienced something very different. So, the first question, at any staff meeting with the Malagasy team every week is, how are your families? How are you doing? How are you feeling? How are you first and foremost?
Yep.
And I know we're all asking that of ourselves and our own families. And I think that's one of the most important things we can be doing for our friends that are health and family that are healthcare professionals here too.
Yeah. Yeah, it's so true. And checking in every day on the team there. And it helps them to know too that if necessary, if we get overwhelmed here, I'll be going back into the hospitals as well.
Yeah.
Yeah.
Trina, I'm conscious of time. About 13 or so minutes left. I want to ask both Kinari and Ashley about the bright spots, and then I'll give it back to you for questions. We've been working with a Canadian researcher, Elena Bennett. We can share her TED Talk with you. She's extraordinary, and her research, one of her many research projects, is called The Good Anthropocene and the Search for Bright Spots. And we are one of 500 bright spots. So I want to ask Kinari and Ashley, the planet right now, we know it's undergoing a remarkable transformation with carbon emissions plummeting, unfortunately, because of this pandemic. That's, what some people are calling a silver lining. But how do we in wealthy nations not lose this momentum? What lessons can we take and integrate into our daily lives for a better and brighter future?
Yeah. So I'll just say first, rainforests absorb a third of the carbon that is released each year. But imagine what those rainforests could do for us if we weren't releasing as much carbon, right? Like, they can actually help reverse climate change, right? So that is, and I look at this situation, I think every one of us should be looking at our lives and really having a moment of pause and saying, how can I live more in balance with the environment? Even as a team at Health and Harmony, we're thinking about that. We're like, wait a minute, maybe we don't need an office. Maybe we'll all just work from home. I think there are all kinds of creative ways that we that as we rebuild our economy, and I just wish that much of the stimulus was used to shift us to an economy that's away from carbon. If we need to rebuild our automobile industry, let's just push it all towards electric cars. what I mean? Like, that's just a small thing, and I'm not sure that's really the right solution. But you know what I mean? Like, really seriously, like, let's think about how we can use this time and the restructuring that needs to happen in a way that honors the earth and prevents something like this from happening again.
And I think I totally agree, Kinari. I think that's beautiful. And I think a bright spot for me is seeing the subnational response that's going on in different countries around the world. And so, you know, we see that here. We see that New York, I think, has been a bright spot in this nation. We see that at the subnational level in Indonesia. We see it at the national level in Madagascar. But you can see people taking action in very big ways. And despite what the national rhetoric and response may be, there is power in the people and how people are responding. And so I think that's very, very important for us to be hopeful about and have faith in. And also just we're having a global conversation that happened overnight, and there's so much power in that. You know, we're all speaking the same language around social distancing, or now it's physical distancing and socially connecting. You know, how do we take care of ourselves to be able to take care of the wisest elders of our societies and really care for their health and their well-being and their survival? And so I think what this shows us is we are so hyper connected in this moment, and that can continue to be used for good. And so our voices are strong, and we have to keep making them be stronger and kind of keep carrying this. And it's important to have hope, and, you know, in this very scary, very difficult time. So.
Thanks both. Well said. Trina, we probably have a few more minutes for a question, maybe.
Yeah, I love this one from Catherine about the unique social and socioeconomic factors that we might be considering with respect to COVID-19 that might be a blind spot to other people in the field who are working in Madagascar and Indonesia, who lack that on-the-ground experience.
Jonathan, you want
Great
to
question. Tough question. So put it to us again, Trina. It's about the socioeconomic elements or the livelihood elements that other organizations might be blind to.
Yeah, sorry, my screen jumped right in the middle, so I didn't read it very clearly. But what are the unique cultural and socioeconomic factors you're considering in your preparations with respect to COVID-19 that might be a blind spot to those from the global north who lack on-the-ground experience?
I think for us right now in Madagascar and lots of places, you know, distribution and those networks, it's very difficult and it's very complicating. And so, you know, how do we think ahead, you know, and prepare for things like this in the future? You know, we are constantly thinking about sustainable and alternative livelihoods. And so I think there's an opportunity for us to potentially offer more insight through the communities in which we work into what those can be, you know, alternatives to logging and mining and extraction, where we can turn to organic farming and agroforestry and sustainable extraction and production. So I think there are actually more opportunities than there are blind spots in this situation.
Yeah, and that's what I was going to highlight. The employment transition that you articulated, we call just transition many times. And I think with the stimulus packages and with the thinking that's going into this, I think a fundamental element of change globally in every country is the just transition of workers who are today doing X, supporting them financially, psychologically, and through technical training so that they can do Y. And I think that's critical. Kinari, you wanted to say something?
No, that's good. I want to talk about the help that you all can provide. We need your help right now. This is an incredible moment for Health and Harmony. We are perfectly placed in both Indonesia and Madagascar to have an incredible impact. And I I wouldn't have expected this, but like we like need to move full force. And it's not only to save potentially millions of lives, but it's also to protect our healthcare workers, our entire staff, and it is to change the conversation so that this kind of sustainable paradigm becomes the norm of how we talk about recovering from this. And we need your help to do that. Please, like now's the time. And honestly, days make a difference.
Yeah. Yeah, well said. So in closing, I'm conscious of the time, just a few minutes before, 5 o'clock here on the West Coast. Brian McAdoo, I'm not even sure what time it is there. But I really want to thank you all again for joining us for this hour. And I just want to let you know that your support makes a huge difference. It has for many years, and it will make a huge difference right now, as Kinari was saying. And if you would like to support Health in Harmony's work in Indonesia and Madagascar, we would be enormously grateful. And here are some of the ways that you can support Health in Harmony right now. Number one, being kind to one another and staying focused on the behaviors that we can change in our individual lives and lifestyle for the sake of the planet. The second way that you could support us is by staying safe, healthy, and engaged, because there's power in collective action for both coronavirus and for the climate crisis and climate change. And you can donate to Health in Harmony's emergency fund, which provides protective equipment and medical supplies to our medical teams and our partners in Indonesia and Madagascar. And it's also supporting our advocacy through Monica in Jakarta and the Office of the President in Indonesia, and also supporting our teams to advocate in Antananarivo, which is the capital of Madagascar, because we're fortunately placed to be able to have quite a bit of technical expertise to bring to the table at this moment. And then the last way you could support us is by starting a monthly donation if you're able to. Monthly income is really what sustains us. It allows us to be versatile and innovative in our planetary health work, and it allows us to rapidly react to emergency situations like this. And we would appreciate anything that you might be able to do right now. I want to end with the words of a good friend of Health in Harmonies and a good friend of mine, Stephen Cornish. He's the CEO of the David Suzuki Foundation, and he recently wrote, quote, "Together, let's imagine the world after this crisis, one where we recognize our interdependence and act in solidarity, one where we work for an evolution from dominance to partnership, from fragmentation to connection, from insecurity to interdependence." So with that, thanks Kinari, Ashley, Trina, for the amazing work you guys have done for many years and for the last few weeks. And thanks to all of our supporters out there. We'll be following up with some of the information we've talked about in an email. And we look forward to doing this again in the near future. And if you've enjoyed this, let us know, and we can do this more often. But thank you very much for making our work possible.
And Trina's going to share a donate link too in the question and answer section there. And she'll also share the TED Talk and various other things that we talked about. So, thank you all so much. Thank you for all the support over the years, and thank you for your support now, both emotionally, physically, financially, all of it.
Thanks all.
Cheers, everybody.